Tonsillectomy is a surgical procedure in which tonsils are removed. Tonsils are two round-shaped lymphoid organs present in our throat which trap and kill bacteria and viruses entering our mouth. Sometimes in our tonsils, besides bacteria and viruses, food particles and mucus also start accumulating, which cause inflammation and tonsil stones in the tonsils, due to which, apart from bad smell, we may have severe pain, cough, swelling, fever, and in some cases sleeping disorders. In such conditions, it is very important to remove tonsils, for which doctors recommend tonsillectomy surgery. So let's know how tonsillectomy is performed. Before surgery, some tests of patients are performed, and they are not allowed to take any medicine or eat food. During surgery, patients are made unconscious by anesthesia, and electrocautery or cold knife dissection procedures are performed. In electrocautery, anesthesia removes tonsils and stops bleeding. Cold knife dissection, surgical knife is used to remove tonsils, and through electrocautery, bleeding is stopped. In some cases, surgeons use special surgical instrument called snare for tonsillectomy. At the end of snare there is a thin wire loop which grabs tonsils so that there is no bleeding. Similarly, tonsils can be removed through radiofrequency ablation, carbon dioxide lasers, and microdebriders. Tonsillectomy is an outpatient procedure which is completed in 20 to 30 minutes, after which patient is transferred to recovery room, where patients are discharged after 3 to 4 days of hospital stay. Hope so. From today's video you must have learned something new.